Welcome. Have you ever heard of autoimmune ataxia? It's a rare and complex neurological disorder that can significantly impact a person's life. In this video, we'll unravel the mysteries of this disease, exploring its causes, symptoms, diagnosis, and current management strategies. Autoimmune ataxia, as the name suggests, stems from a misdirected immune system. Instead of defending the body against foreign invaders, the immune system mistakenly attacks healthy nerve cells in the brain, specifically those in the cerebellum. The exact trigger for this autoimmune response remains largely unknown. Several factors are thought to play a role, including genetic predisposition, environmental influences, and in some cases associations with underlying cancers, known as paraneoplastic syndromes, or other autoimmune conditions. Identifying these triggers is an ongoing area of research. Let's dive deeper into how autoimmune ataxia affects the body. The cerebellum, the primary target of the immune attack, plays a critical role in coordinating voluntary movements, maintaining balance, and controlling fine motor skills. When the immune system attacks the cerebellar cells, it disrupts these crucial functions. This disruption leads to ataxia, a lack of coordination and balance. The specific mechanisms of damage include inflammation, antibody binding to nerve cells, and T-cell-mediated cytotoxicity, all contributing to the progressive loss of cerebellar function. Autoimmune ataxia is considered a rare condition. Due to its diverse presentation and the challenges in diagnosis, the precise prevalence is difficult to determine. It affects individuals of all ages, although some subtypes are more common in certain age groups. It's important to remember that while rare, it is vital to raise awareness of this condition to facilitate early diagnosis and treatment. The symptoms of autoimmune ataxia can vary greatly from person to person, but the hallmark sign is ataxia, difficulty with coordination and balance. This can manifest as unsteadiness while walking, frequent falls, and difficulty performing precise movements like writing or buttoning a shirt. Other common symptoms include dysarthria, which is slurred speech, nystagmus, involuntary eye movements, tremors, and in some cases cognitive impairment. The severity and combination of these symptoms can vary widely depending on the extent and location of cerebellar damage. Diagnosing autoimmune ataxia requires a comprehensive approach. A neurologist will conduct a thorough neurological examination to assess balance, cord reflexes, and cognitive function. Magnetic resonance imaging, or MRI, of the brain is crucial to visualize the cerebellum and rule out other potential causes of ataxia. Blood tests are performed to look for specific autoantibodies, such as anti-GAD, anti-HU, or anti-RI antibodies, which are often associated with certain types of autoimmune ataxia. In some cases, a lumbar puncture, also known as a spinal tap, may be necessary to analyze the cerebrospinal fluid for inflammation and the presence of antibodies. The diagnosis is typically made based on a combination of clinical findings, imaging results, and laboratory tests. Autoimmune ataxia can be categorized based on the underlying cause or associated autoantibodies. For example, some cases are associated with paraneoplastic syndromes, where the ataxia is triggered by an immune response to a tumor. Others are associated with specific autoantibodies, such as anti-GAD ataxia, which is linked to antibodies against glutamic acid decarboxylase. Identifying the specific subtype can help guide treatment decisions and predict the prognosis to a certain degree. Unfortunately, there is no cure for autoimmune ataxia. The primary goal of treatment is to suppress the immune system, reduce inflammation, and manage the symptoms. Immunosuppressive medications, such as corticosteroids, intravenous immunoglobulins, VAG, and plasma exchange, are often used to dampen the autoimmune response. Physical therapy, occupational therapy, and speech therapy can help individuals improve their balance, coordination, and communication skills. Assistive devices, such as walkers or canes, may be necessary to aid mobility. Symptomatic medications can be prescribed to address specific symptoms like tremors or muscle spasms. The treatment approach is highly individualized and depends on the underlying cause, severity of symptoms, and the individual's overall health. Currently, there are no proven methods to prevent autoimmune ataxia. Since the exact cause is often unknown, preventive measures are challenging. However, maintaining a healthy lifestyle, avoiding environmental toxins, and addressing underlying conditions associated with autoimmune disorders may potentially reduce the risk. Further research is needed to identify modifiable risk factors and develop targeted prevention strategies. The prognosis of autoimmune ataxia varies greatly depending on the underlying cause, the severity of the condition, and the response to treatment. Some individuals experience a gradual progression of symptoms over time, while others may have a more rapid decline. Early diagnosis and prompt treatment can improve the outcome and help manage the symptoms. Researchers are actively investigating new therapies for autoimmune ataxia, including targeted immunotherapies and regenerative medicine approaches. Clinical trials are ongoing to evaluate the effectiveness of these novel treatments. Stay tuned for updates on these exciting developments in the field.